All right, it is the top of the hour for me, so I think we'll go ahead and get started. I'm sure we'll have people joining us for the next few minutes, but we do want to keep on time. We've got a lot to talk about. So hello, everyone, and welcome. I do want to let you know that this meeting is going to be recorded, so we'll be able to share it with our colleagues who are not able to attend live. But I do want to thank everyone so much for joining us today. This is our third installment of strategies and tips for nursing assistant instructors, titled How to Run an Effective Skills Lab. My name is Katrina Pelow, and I'm a marketing manager at GW Publisher. Today, I'm very privileged to be joined by Sue Rowe, author of The Nursing Assistant Essentials of Holistic Care, and Vicky Castillo, president and founder of FACETS Healthcare Training. Before we begin, I do want to note that Vicky and Sue are really hoping for an interactive session today. So please do not hesitate to share your own best practices, some questions or comments throughout this meeting. We will pause for questions just as they come up. So as I get ready to turn things over to Sue and Vicky, it'd be really great to hear from all of you, your names in the chat, the institution that you're associated with, and it'd be really fun to know how you heard about us and this webinar. So at this time, I'll turn things over to Sue and Vicky.
Everyone, I'm Sue Rowe, and it's my pleasure to be here today. As Katrina shared with you, I'm the author of the Nursing Assistant book with a holistic nursing practice emphasis. It was a wonderful opportunity to be able to write the book and to be able to share some of our thoughts and tips and strategies with you. I live in Tucson, Arizona, and it's hot. So Vicky lives in Phoenix, so she'll tell you it's hot as well. My background is pretty varied, from administration to leadership to being a nursing faculty member, and also being very involved with nurse assisting in terms of overseeing nurse assisting programs, particularly in the high school. And that's really what led me to my love of nurse assisting and the importance of that particular level of caregiving, as well as working with nursing instructors. So with that, I'm going to turn it over to Vicky.
Hi, everyone. Thanks for joining us. Again, I'm Vicky Castillo, and I am the owner and founder of FACETS Healthcare Training, a nurse aide test prep. And in addition to that, I also have been teaching lecture, lab, and clinicals for nurse aide training programs for 14 years or so, in addition to bedside care as well. And then to add to my experience and my expertise of nursing assistant, I've also been a test evaluator for about 10 years with Headmaster. Many of you are familiar with Headmaster. They're one of the 3 major test vendors throughout the country, nurse aide test vendors. So I was a test evaluator for them for about 10 years. And then I was also a test evaluator for Credentia, previously known as Pearson VUE, for about 2 years as well. So the information that I share with you today is both from the perspective, not only of it as a nurse, but as a nurse aide educator, and also as a test evaluator. So what we will discuss today: best practice to prepare for labs, ways to maximize student learning during lab, and post-lab wrap-up. So as you can see there, I've broken down the topic to 3 main areas: preparing for lab, what we do during lab, and then after lab. So trying to, how do you eat an elephant? Small pieces at a time. So that's how I'm approaching this webinar today.
So we have a poll question that we want to ask you before we get started. And so the question is, what do you think is the most common student complaint about learning lab skills? Not enough lab supplies, or not enough practice time, inconsistency in instructors' teaching skills, and inability to perform the skill correctly the first time. So go ahead, Katrina, and put up the poll. And please, folks, let us know what you think, and we'll see what the large group believes to be true in terms of the answer.
just a few more seconds here where the answers are coming in, and then we'll share the results with everyone. All right, let's end the poll and share the results.
Aha. So let us show you the answer. So you were close. Many of you were close. And Vicky, did you want to make a comment about the answer to the question?
Sure. Yes, and it's the inconsistency in instructor singular, if it's just you just have one instructor or multiple instructors teaching skills. That is one of the most frequent complaints I received as a CNA program coordinator and as a nurse aide, director of nursing, and I was the CNA program coordinator to the largest nursing assistant school in the state of Arizona. So we trained, it varied from year to year, but give or take about 700, 750 students per year. So that was the #1 complaint. And there was a period in time where I had about 23 instructors that reported to me. So there was some real issues going on there. So that was the #1 complaint students had, is the inconsistency in teaching skills. All right, so let's start with the beginning, preparing for lab. So when preparing for lab, first recommendation is to list the skills in the syllabus. When listing the skills in the syllabus, list each skill and their checkoff date. Provide the syllabus on the first day of class or before class. If we can provide the syllabus as early as we can in the program or before class, it gives the students an advantage, and it helps us out as well because it helps them to prepare. It helps, again, the students to prepare for lab. It helps instructors prepare for lab, and it reduces student remediation and reduces the time spent by instructors re-demonstrating skills. And we know that we don't want to re-demonstrate skills. I want to do them one time, check the students off, and move on to the next skill. And then deviate minimally from the syllabus as well.
Yeah.
And Katrina, can we ask people to mute themselves, please? Okay. All right, so deviate minimally from the syllabus. I didn't finish my my point on that because it causes confusion, and then the students have to go back if they've been working ahead. They had planned. They get thrown off on the course. So stick with the syllabus as best as you can. Next slide, please. Agree as instructors on how each skill will be demonstrated. Even if it's just one instructor, you're the only instructor, you want to have a plan for teaching that skill each time the same way. And if you have multiple instructors, that's especially the case. Practice minimal deviations from established and agreed upon procedures. And that was the case when we had I had multiple instructors, and decide ahead of time on the skill steps. What supplies are you going to use? What is going to be your actor setup? And when I mean by actor, I mean the person that's going to be in the bed, whether that's going to be a student you're going to use as your actor, or you have some other setup. And the approximate completion time for each skill, because there's a huge difference between practicing a skill like pivot transfer and occupied bed. There's a huge difference in time spent between those skills. So we have some very lengthy skills, and we have short skills and medium time skills as well. Okay, so plan the logistics of the lab. How many instructors are available to assist? How many skills are needed to be completed? That all needs to be given thought. How much lab time do you have? And how many beds or supplies are needed and available? So if you have 20 instructors and you have an hour, 20 instructors, if you have 20 students and you have 1 hour and you're planning to check off all the students on occupied bed in that 1 hour, it isn't going to happen. So we need to have a logistics of what do we have as supplies? How many instructors do we have? How long will the lab instructors be there? And that all has to be taken into account when planning out the logistics of the lab. Plan the logistics of, also plan on the logistics of moving students from station to station and tasks to complete while they're waiting their turn to do skills. And my fallback position when students were waiting to do skills was doing vital signs. It was required that the students had to do at least 30 vital signs to complete the course. So when they were waiting for their skills to come to my skill station or a skill station, they were working on vital signs. They had a vital sign sheet and they were working on vital signs on each other. So downtime, there wasn't any. They had to be moving. We got a lot done. So that's what you want. You want to maximize that lab time. Next. Set up and organize the supplies ahead of time. Have enough and the correct supplies on hand. Washcloths, towels, gait belts, blood pressure cuffs, stethoscopes, including teaching stethoscopes. That's especially important when you're teaching manual blood pressure, especially if manual blood pressure is a state board testable skills. You want the students to use those teaching stethoscopes. You want them to be familiar how they work, how to use them and whatnot. You want to take away as much of the mystery of using a teaching stethoscope as possible when they go into certification. You want to make sure that the wheelchairs are working and all their equipment is in good working order. That's very important. I have been in places where the wheelchair brakes didn't work, or the bed brakes didn't work, and so the students had to pretend. There's no pretending in the certification test, and we don't want them to pretend in clinicals either. So the equipment should be in good working order. Determine if the skills will require access to a sink for water or no water is needed, what I call dry skills. So on days that you are doing wet skills, will you have sufficient linens? That's a real issue. And for me, especially when I was teaching it, all the courses, because I had weekend, evening, and daytime courses, we're going to be doing all wet skills all in one day. I knew there wasn't going to be enough linens. So I had to think of logistics of how I was scheduling my skills based on the linens as well. And it may not seem like a big deal, but I know that you all are aware that linens are an issue, and I'm going to address that later on in the PowerPoint. Okay, and then have on hand, part of the recording as nurses, have on hand the nursing assistant skills checklist. I'm going to add a handout to the chat here on the, okay, so I'm having trouble uploading it, but I will have that available, and I'm sorry, but I'm not able to upload it here because it doesn't give me that option. Let's see here. No, it doesn't give me that option. So sorry about that. I don't know if you're able to, Katrina, but I wasn't able to go into the SharePoints that I
no, it's not working, but that's okay. We'll be able to share the handouts as part of sharing the recording too. So we will be able to give you those handouts. There's 2 of them today.
Okay, sounds good. Well, the handout is a checklist, and it's the checklist that lists the skills, whether the students demonstrated the day demonstration, and then the nurse signature says that the student completed the skill with competency or not, comments and whatnot. So we'll share that with you all later. Okay, next, please. Okay, so assign pre-lab homework. And what is that pre-lab homework? Read the skill in the nursing assistant candidate handbook. So I require the students to read the skill in the nurse aide candidate handbook. The skills also, they should read them from the checkoff rubric, which is handout number 2. In the FACETS healthcare training platform that I have created rubrics for each of the skills, and many of the instructors use them to check off students during lab. And also it helps the students know what skills how they're going to be graded in the skills, what steps are heavily weighted, and how they're going to flow in terms of how they need to do them. So that was handout number 2. I'm sorry we're not able to share that, but it is a rubric that I have created, and we will send that out, make it available later. And then the other part of pre-lab homework for the student is to watch skill videos before lab. So let's talk about instructional videos versus certification videos. Instructional videos are useful for teaching general skills, typically skills not tested on the certification test. And these you'll find in most textbooks. Many of the textbooks have a video library, very nice videos, and those videos have to do with skills most of the students are not going to be tested on for the certification test. Giving a shower, using a Hoyer lift, how to shave a patient. Those are very useful, but they are not reflective of how the students need to do skills in order to pass a certification test. Okay, so the certification videos are useful for preparing students for the certification test. As many of you know, I do have those certification videos on the FACETS healthcare training platform. And then be cautious about using skill videos from a textbook, YouTube, or some other unreliable source to prepare students for the certification test. So I'm going to hand it over to Sue just for a moment here. You're muted, Sue.
I was muting so that I wouldn't have any background noise, and I'm just, thank you. So what do you use as skills practice resources? And you can either raise your hand if you want to use the icon, or you can put it in the chat box. Have anything in the chat box yet, Katrina?
Nope, nothing yet. We do have a hand raised from Alma. Feel free to unmute.
Thank you. Yes, I attach to our skills videos. We have our own set of videos, and I attach a quiz to our LMS. So that ensures that the student will view the video before class. And I had it with Canvas, so Canvas grades that quiz.
Great. So I do see some comments in the chat box. Self-recorded videos based on parametric handouts.
Excellent.
Hartman CNA videos, Metro Community College videos. I have Del Mar's NA skills and procedures.
Okay, excellent.
Anything else?
The only other comment that came up was check off sheets, textbooks, video. So kind of just rehashing that or affirming that. And then students record and demonstrate also to instructors.
Oh, okay, okay, okay. Very good.
Excellent. Really nice cross-section of different kinds of resources. Thanks for sharing.
Yes, thank you. Excellent. All right, so I want to spend a little bit of time talking about the Nurse Aide Candidate Handbook. It's not a lab unless we talk about the Nurse Aide Candidate Handbook. The Nurse Aide Candidate Handbook is provided by most test vendors in each state. The handbook lists the skills students will be tested on for the certification test. Provide the students with a Nurse Aide Candidate Handbook on the first day of class. It's essential that you do so. I know that some schools call it, you know, the golden book or the Bible, or you might have different names for it, but it is something that I tell them that has to stay at their side on the first day of class, and it has to stay with them till they pass the certification test. They have to bring it every day to class, every day to lab. Each instructor should have the candidate handbook upon hire as well and become a content expert. The students are going to ask us as instructors this or that or the other about the certification test, and we want to be able to answer their questions with knowledge. To say, I really don't know, I'm here to teach, but I really don't know, doesn't make us credible. It just doesn't. So use the skills in the candidate handbook as a template for lab skills checkoffs. Okay, and then in the candidate handbook, review the testing policy, skills corrections, mandatory skills, and the testing time. And this is important because it reinforces to the students why we do the skills the way that we do them. This is the way the test vendor wants it done. And if you want to pass a certification test, this is how it has to be done. Because I would sometimes get from students, well, that's not real life. That doesn't make any sense. I said, do you want to be a CNA? Do you want to pass the certification test. Well, yeah, that's how you have to do it. You can't argue with the test vendor. That's how it has to be done. So that's how it, and they need to know that. They need to know that. All right, next slide, please. Okay, so provide a thorough orientation. That's also part of preparation, is provide a thorough orientation to new instructors, whether they are experienced or not. New hires are new to your school and your way. And create a written orientation schedule with a checklist, an orientation schedule that is flexible. Why do I comment on the flexibility of an orientation schedule? Because many CNA instructors are part-time or PRN, and they need flexibility in their orientation schedule. We don't want to lose a good candidate because we just were inflexible with the orientation schedule. There's such a shortage of CNA instructors, and we're such a specialty field that we want to retain nurses in, as much as we can. And instructors must practice skills to ensure demonstrations are proficient, accurate, and show confidence. We cannot teach what we don't know. We cannot instill confidence and competence in our students if we're not able to model it. So I have had students comment to me, Ms. Castillo, I don't think that instructor knew what they were doing because they didn't seem to do the skills right, and they were just kind of fumbling around. That made me sad. So how do you practice? You just go in the lab and practice on your own, practice with a colleague. Just get good at it, do it over and over again. But we really, when we go up before on a stage, we should be on task, on point with these skills. Next, please.
Another wonderful question to ask you. We're interested in what one best practice that Vicky shared that you found most useful. So again, you can use the icon to raise your hand or go ahead and put it in the chat.
And while we're waiting for responses to that, I do want to share, because I thought this was really cool. One instructor said that they make their own videos for the 21 essential skills for PA, and then they make a private YouTube page for the students. So I think that's a really great way to use your resources, to have that separate page there for students to be able to access for the class.
Yes, very creative, very, very creative. Excellent.
So did any of what Vicky shared resonate for you as a best practice in terms of what you're already doing or what you think might be useful? So we have having the students pre-watch the skills videos and read through the skills prior to going over them. Nice. Anything else? See one, do one, teach one. Familiar to us. Someone agreeing that it's a good idea in terms of getting the students to be thinking about what they're going to be doing prior to having to do it.
Excellent. Yep. Muscle memory. I heard one instructor say one time, muscle memory. The more that they see it, the more that they write it, the more that they do it, the more ingrained it becomes.
Practice
Instructor orientation.
Right.
Yes, love that. Absolutely, Alma. The days of being just thrown in and just figuring it out and just sink or swim should be behind us. We shouldn't do that to our colleagues. I know it's happened to us many times in our nursing careers, but it's not a good start, and we want to retain our nurse aid instructors.
Okay.
All right, so moving on now to during lab. So we are now on lab day, and we have started it. And at the start of lab, remind students of lab expectations. I write it up on the board. This is what everything has to be done today when we finish lab. That's what I do. I write it up on the board. These are the skills, remind them on the skills to be completed. We have to get these 4 skills done today. We got to get it done. I tell them that. Lab logistics, while this group is on this station, this other group will be in this station, this other group will be in this station, and this is how we're going to do the flow. Remind them on tasks to do while awaiting their turn. Okay, so while you're waiting your turn, this is what needs to be done. And then remind them that passing all lab skills is required to pass the course. So reiterating this sense of urgency to them. And then reinforce lab safety, maximize valuable lab time, and limit socialization. Lab time is limited. We all know that. We have a little bit of lab time, and we have to make the most of it and be as productive with it as possible. And then with the socialization, as many of you know, learning should be fun. I get that. I like to have fun too, but I have some social butterflies in lab, and they get behind because they just love to socialize. And next thing you know, they're not completing the tasks that need to be completed for the day. So I wanted to put that plug in there about the socialization during lab. Students should also use the test vendor's recording form to practice during practice documentation. So every test vendor has a recording form. It's in the candidate handbook. You should make copies of those recording forms and have them during lab so that students can record, practice recording during lab. Everything that you can do to demystify the testing process for certification, we should try to do. We don't want them to go into the certification exam and say, oh, where am I supposed to record blood pressure? And what is this form for? No, if you can use those recording forms during lab, you really should. Again, it's in the candidate handbook for Prometric, Pearson VUE, and for Headmaster. All these test vendors provide these. I had my administrator's assistant make tons of copies of them, and I used them during lab time. Next, please. Okay, so instructor demonstrate. So during lab, the instructor demonstrates the skill, and then followed by a student. The student demonstrates afterwards. So I want to just caution that only showing a skills video is not a replacement for an instructor demonstration. So I have had instances in which instructors were not confident, they didn't have practice, they didn't want to, they thought it was, they didn't want to put the effort in to demonstrating skills in front of the students. So instead what they did is they showed the skill video in class and then just had the students demonstrate. I don't recommend that. We are the instructors, and when I'm demonstrating skills, I'm talking through the skills. I'm telling the students what I'm doing while I'm doing it, what I shouldn't be doing, and why I wouldn't do that. And the students learn from that. Video is fine as a supplement, but it doesn't replace us, the nurses and the instructors. So please don't use the videos to teach a skill. That's our job. It's there to reinforce and to help with learning, but we are the primary educators, us. Okay, so I wanted to just share with you how I do the skills, and I thought that some you might have a takeaway from this. So the first step that I do is I ask for a student volunteer to read the skill from the Nurse Aide Candidate Handbook in class out loud and as the class follows along. I always ask for a volunteer. I never point out a student. I never force a student because, again, some students don't do well reading out loud. Some students have reading challenges, and some students are ESL. So I don't force anybody. I ask for a volunteer. So we read the skill from the candidate handbook out loud in class. Everybody follows along. Next step, the students writes down needed supplies and key points on the margin of the candidate handbook. So I say, on your candidate handbook, I'm going to dictate to you all the supplies that you need, and then the key points I want you to be aware of. So they start writing it. And as they're writing, they are learning. They're making, again, muscle memory of learning that skill. The next step, I demonstrate the skill in class, the entire skill in class. And then the fourth step is the student demonstrate the skills, does a return demo, and I observe a maximum of 2 students at a time, and I'll talk about that in a minute. So that's my 1, 2, 3, 4 for how I demonstrate the skill. All right, So during lab, no skill pretending, no pretending on skills that require using water or locking the bed brakes or locking the wheelchair brakes. Use real water if the skill calls for it, and use real warm water if the skill calls for it. We have to, because that's the way they're going to be required to do it in the certification test. Remember, the way that you teach them in the lab is the way they will do the skill in clinicals or on their certification test. Okay, I wanted to pause here for a second and just share with you that I wanted to put this slide in here because as a test evaluator, when a student had a skill that they needed to use water in the basin for, they would often say, am I going to use, not often, occasionally I would get students that would say, do I need to use real water? Do I need to really fill the basin, or do I need to put water in the basin? And my comment as a test evaluator was, do whatever the nurse aide candidate handbook says you should do, because I'm not there to guide them, I'm there to observe them. And the students would comment to me during testing as an evaluator that they did not use water in class when they were learning these skills. They would only pretend that there was water in the basin. You don't want to do that. If it calls for water, use water. Do them as actual as you possibly can. Next, please. Okay, so a maximum of 10 students per instructor in the lab, unless less is mandated by your state. So some states have a lab instructor to student ratio and some do not. In Arizona, there is no ratio, but my ratio for my school, I implemented it, was 10-1, because that's about all I can manage in a class in the lab is 10-1. So when I had more than 10 students, I had to get another lab instructor. And then also depending on the skills that I was doing. But for the most part, that was my guideline, about a 10-1 ratio, instructor to lab, instructor to student in the lab. Okay, and then only evaluate or observe a maximum of 2 students at a time. So why do you think that should be, that we should only observe 2 students at a time? Okay, I was just looking at some comments. So I'm gonna move on here while the comments come in. And that's because we want to observe the students doing the skills in detail. I've been told by instructors, and I have observed that some instructors say that they can watch 6 to 8 students at one time doing a skill. Not with detail, not in detail, you cannot. We need to watch them actually locking the bed brakes, actually locking the wheelchair brakes. And we can't monitor, we can see them, we can't watch the details of what they're doing. And again, however they are checked off in lab will be how they do in the certification test. And some of those habits, if we miss it in the checkoffs, they'll probably miss it in certification too. So 2 is the most, even I watch. I don't watch 4, 5, 6, 7 students doing skills to check off for demo. I don't do that. So allocate enough time to complete each skill so you're not feeling rushed, and neither are the students. So remember, some students will need to have remediation, and is each instructor remediating the same way? And what resources are you using, and are you consistent? And the way I typically remediate is I have the student watch a video in class. I'll have them watch the video in class. And then I tell them, come back because you missed too many steps, come back when you're feeling ready, and we'll try it again. And the other way I remediate is I tell the students to just get to the back of the line of the skill line and then watch a couple of students in front of them and then come back and then try it again. So that generally works pretty well. Not always, but most of the time that's usually works pretty well. The student needs to watch somebody else do it a couple more times before they can try it again. Next slide, please. Okay, and then demonstrate skills that will not be part of the certification test. We can not teach only to the certification test. Of course not. We want to create well-prepared students. So various skills require both teaching to the test and actual clinical, various skills require both teaching to the test and actual clinical practice. And the first skill that comes to mind to me is bedpan and output. Most states have some kind of skill that requires bedpan and output. And so the skill for the certification test requires putting the actor in the bed on the bedpan a certain way. But in clinical practice, you know that most of the time the patients are not going to be able to lift their hips up. We have to turn them on their side. So when I'm demonstrating that skill, I say, this is how you need to do it for the certification test, but this is how you're probably going to have to do it in clinical practice, because most patients are not going to be able to lift their hips up. So be sure to explain the differences to the student. It does require extra time when I'm teaching some skills, because I have to teach it in so many different ways. But it's well worth it. And then do not allow students to check themselves off on skills, which I have seen instructors do. So Sue, I'm going to hand this off to you. I'm going to hand this one off to you.
Okay. So the question obviously is, why would you not allow students to check themselves off on skills? What's been your experience?
And please feel free to unmute yourself and share any comments you have about this.
Any thoughts? Go ahead, Alma.
But to start with, it's illegal because CNAs cannot supervise CNAs. And they're not proficient, so they're going to just mess it up more.
Good points. Good points. I have too easy on each other and letting things slide. So we've seen that happen. They rush through it and are not accurately checking off the other students. They'll miss important safety details and might be dishonest. Same with RN students, by the way, Vicky. Yeah, I think we've all had that happen. They will check boxes even when they're doing the skills incorrectly. Yeah, good points.
Yeah, those are really great points. And the other thing also is they give their classmates minimal credibility, because like, well, they're trying to correct me. They don't know it themselves. It's like, why are they trying to correct me? They haven't ever done this themselves. You know, I think I am doing it right. No, I'm not doing it. Oh my word. So I don't recommend it. I don't recommend it. We're the experts. We're the teachers. We have to be the one that check them off on skills. Great comments. Love it. All right. Next one, Katrina. Okay, so during lab, I know there's a lot here, but we're going to get through it here. Documentation, of course, we can't get beyond past documentation. We can't get out of documentation as nurses. So we need to document on the skills checklist. And then if you're using a skills rubric on that as well. So follow the rubric. If you assign the rubric, follow the rubric. We want to be consistent with that. Only give the student a pass if the return demo is correct. Feedback on this, that we're giving them, the written feedback should be objective, address areas of strength and areas for improvement. And then I use the acronym SMART for feedback. It should be specific, measurable, achievable if they have to come back to you, reliable, and then timely. Give students written feedback on their lab forms, and then they should be timely again. Students should always know what their lab grade is. We don't want to have a student know what that they're not passing lab on the last day of class, on the last lab. No, we've done something wrong if they aren't aware what their lab grade is or that they are failing. That's on us. So they should always know how they're doing in lab. Okay. So the skills checklist, I know that you use one. Most states have their own version. It is a legal document. Completion is required by most nurse aid regulating agencies, whether that's your Board of Nursing or your State Department of Health Services. The skills checklist is needed for program renewal because you'll have to show evidence that you are checking students off on all the skills that are required by your state. And it's also evidence of student progress in case a student challenges the instructor or the school, which all of you know that happens. So you want to have documentation as evidence. Next slide, please.
So another question for you. What one area during lab do you think you can improve? So I'm sure you've had thoughts about that. So it'd be wonderful for you to share a bit about your improvement thoughts. Again, feel free to use the chat. Have the students prepare ahead of time for each skill, allowing enough time for cleanup at the end, getting students to put things back. I think Vicky will talk about that in a minute too. Anything else? Keeping the ones busy who are waiting. This is my biggest challenge. More logistics of time while waiting.
I like the idea of having the students actually participate and read the steps off so that it kind of gets everyone interacting, not just the students that are demonstrating the skills, but having it heard, seen, and then have them do, you know, constructive criticism.
Good point. We have time management overall. It's another time issue. Unfortunately, there's never enough time, is there, to try to get everything done? You want to use it well.
Exactly.
There you go. Creating a schedule to stay on task, which obviously is very helpful. Okay, Vicky, go ahead.
All right, next slide, please. Okay, so we are now after lab, post-lab wrap-up. So administer 2 exams. So a skills final exam, and the skills final exam can be at the end of each skill day, that's up to you, or at the end of completing all the labs. So towards the end of the course. The skills final exam should be one that mimics the state certification test and grades students the same as a state exam. You want to get them prepared. You want to get them prepared. And then number 2, a written exam on the certification skills. If we test them on the certification skills, that again creates more muscle memory, more learning on those skills. And I have those written certification, the skills tests on the FACETS website as well. And I get a lot of positive feedback from instructors that use them. Use the Nurse Aide Candidate Handbook as a guide to both final exams. And administer the skills final exam after clinicals and use it as a reset, because you know they cannot pass the certification test if they do their skills like they saw them done in clinicals. That is a recipe for disaster, and we know that. There's no way they're going to pass their certification test if they do skills like they saw them done in clinicals. So I use the final exam as a reset. As a reset, I said, whatever you learned in clinicals, you need to get it out of your head. Forget about it, what you saw there. Now I want you to focus on doing the skills like this candidate handbook says, because now we're getting you ready for the certification test. So administering a written exam on the certification skills, reevaluate student understanding and the recollection of skills. Again, helping them with that reset. And then list both final exams on the syllabus, making it a course requirement to pass. I list both of those tests on my syllabus and say you have to pass both to pass this course. Next slide, please. And then after lab, include in the skills final exam those certification skills that are highly failed, either in your school or in your test, in the certification test. So Sue?
Which do you think they are? Which are the certification skills that are highly failed? Blood pressure? Vital signs and pericare, vital signs. Yeah, you're on it. Yeah. Probably pericare, blood pressure and vitals, all vital signs. I think we have a common answer here, Vicky.
That is it. And that's pretty much statistically nationwide is manual blood pressure, vital signs, and feeding is another one. If you have feeding, it's because of the documentation and calculation, the math in there too. So yes, excellent. Yes. And then I think most of you are aware that the skills certification part of the exam is failed more often than the written. Okay. Next slide, please. And then after lab, students should assist with tidying up the lab and putting away supplies. It's not just on us, they need to tidy up as well. Verify return of items easily lost or misplaced, okay. Pulse oxes get misplaced and lost. I put out 6 and I only get back 4. I don't know what happens. Thermometers and mannequin perineal parts get lost, misplaced. And then I also review the syllabus for the next lab session so that they can prepare for the next lab. And then I also announce steps for skills remediation or skills redo, is particularly for those students that need to come back and be checked off, and for those students that want to practice some more, okay? And then my last point here is the dirty laundry dilemma. Oh my word. So the dirty laundry dilemma is that if you all have a washer and a dryer accessible to you at your school, what a blessing. How wonderful, you hit the jackpot. But for those schools that don't have a washer and a dryer at your school, it just becomes a real point of contention when we don't have laundry or we're trying to figure out who's going to do the laundry. Laundry services are expensive. And then sadly, I've even had where instructors take the laundry home with them, use their own resources, their own detergent to wash the laundry themselves and fold it and bring it back to school and never get compensated for that or even recognized for that. And I'm saddened by that, but it is a real issue. We're going to create laundry. So share with us what you do for your laundry situation. We'd love to maybe get some ideas.
Go ahead, Alma.
We have a drying rack for our washcloths. It's just water and now at the end of certain weeks we do all the laundry, but for washcloths we have a drying rack that we put them, then we the next day we fold it and put it back in the lab.
Okay.
That's one of the resources. It works well with us.
And Alma, what about when you change the beds out, like the fitted sheets and the flat sheets and the pillowcases and whatnot, because we should be changing those out frequently as well, routinely.
Yes, for those items, we do have one washer and one dryer here in campus and in our building, but sometimes it's not enough. Then we use laundry services. They are expensive.
They are. Okay.
Looks like some folks have washer dryers. Some folks are using washer dryers at other parts of the campus where there are washer dryers. Some folks are fortunate to have a pickup and drop off laundry service. Mary takes it home and washes, folds, and returns it. She's trying to get a washer dryer. Good for you, Mary. Kudos.
So, and that's the other thing, if you're going to change to a different office or a different school setting, a different facility, you're going to rent a different space because you're growing, or you are thinking about starting up a CNA school and you're looking at office space, consider that as one of the things that you would want an office space to have is a hookup for laundry services. I know it may not always be possible, but it's important because let me tell you, it is a beast, that laundry. It really can be. It was a beast for me. Imagine I did 700, I trained 700 students per year. Imagine the piles of laundry that we accumulated every single day. It was a task. It was arduous. It was an arduous process. Okay, any other comments? All right, excellent.
All right. Well, I do want to let everybody know just a little bit about the two nursing assistant textbooks that we have at GW, authored by Sue Rowe. You can see them both on the screen here. The first one that I have is the comprehensive title. So the Nursing Assistant Essentials of Holistic Care Comprehensive. It just has a much broader focus and is really best for a longer program. So the comprehensive textbook will incorporate more long-term care and the acute care setting, and it has a much deeper detail in like anatomy and physiology, pathophysiology, and disease. The comprehensive textbook also has expanded areas of study, including a whole section on special populations, such as mothers and infants, pregnancy and postpartum, and a whole section on surgery. So the brief edition, Essentials of Holistic Care Brief Edition, is really best for a shorter course. So this textbook includes all of the core content and skills needed by nursing assistants, and also contains chapters on wellness and illness, health promotion and self-care, certification, employment, and advancement. So rather than main titles in each section, the brief book will open up with care-focused questions that relate to the content. An example is, how can you help yourself and your residents achieve wellness? So both textbooks will contain practice examination questions at the end of every chapter, and 2 full practice exams, as well as a complete video library. There are also 70 procedural checklists available for more hands-on practice. I do want to note thank you to those who have direct messaged me requesting access to these resources. We're very happy to provide you with a complimentary desk copy or work with you with online instructor resources. So I'm very excited to be able to send those to you, and anybody else later on as you think of it. We'll be showing our contact information here. Please feel free to email me, and I can make sure that you get access to those books, a hard copy or online, whatever's your preference. So again, just a note here about our contact information. Please don't hesitate to reach out to any of us. Again, Sue Rowe, Vicky, myself, we all have our contact information up here, and we're really excited to just have this community with all of you. And so never hesitate to connect with us.
And Katrina, I have put there. Katrina, I put there how to join my mailing list. I asked you to join the mailing list, and the reason why is because I provide a lot of updates to not just FACETS, product updates and whatnot, but also regarding test vendor changes. Lots of test vendors, I call it musical chairs of test vendors. Any updates regarding test vendors, testing procedures, just general information about CNA education. So the link is there, and I'll put it in the chat. So for the how to join the newsletter, I send out once a month.
It looks like we've got some couple of comments, and Katrina, someone would like us to go through the chat and make sure that we answer any questions or follow up. And I'm sure Katrina always does that for us, so we really appreciate it. Thank you.
Yeah, if we missed anybody today, I'll be sure to contact you directly and get your questions answered. That's absolutely.
There was one question really early on, Vicky, that I thought we might want to just make a comment or two, and that was, someone asked, how long should an orientation be for a nursing instructor?
Well, I think it depends on what role they are going to play in terms of lecture only, lab only, skills only, or all of those. So I think it would depend on that, but no less than a week. And for lecture instructors, which I usually were lead instructors, they did the lecture, lab, and clinicals. It was several weeks of orientation because classroom management was a big part of that. Clinical instructors, they seem to require a little less orientation, but they also have them spend time in the lecture, so they understood what I was teaching and the flow of the class, and then also in lab, so that there was some consistency among that, among all three of those components. So I would say that clinicals probably had the shortest, the clinical instructors had the shortest orientation. So it would depend.
Any other questions that you have before we sign off? We have a few more minutes.
We do offer free trials of FACETS healthcare training. So if you are interested in a free trial, let us know, and I'm happy to provide a free trial to as many instructors as you'd like to have access for.
So as we're waiting to see if there are any other questions, I do want to let you all know that this is a series of webinars, and the next one is going to be in October. It's October 19th, same time. And that one's going to focus on strategies to manage challenging student issues. So we will be, sharing this information as it becomes closer in Vicky's mailing lists, on GW social media. So you'll be able to see this link again, but we just wanted to have it here in case you wanted to register right away. As always, webinars are free. You can attend it live. And if you're unavailable during that time, we will send out a complimentary recording of the webinar.
Yes, and this webinar in October was a request by popular demand. It was a request by nursing assistant educators because they have challenging student issues. For example, students that fail, students that don't pay their tuition, students that are disruptive, students that fail lab, students that just are become difficult. We all have had them. So I decided I was going to do a webinar on this, and no promises yet, but I'm going to see if I can get an attorney to participate, or at least someone that's an additional content expert to participate in this webinar as well, because there's some legal issues with regards to managing challenging student issues. So I'm going to try to bring in an attorney, and I'll see how I do. No promises, but I'm going to try. I'm going to give it all I have to make that happen.
Well, we thank you very, very much for being here today and for being so involved and participatory. And I see people are asking for recording and handouts. And as I said, thank you, Katrina, for being so great at following up. And I know Vicky will look forward to seeing you again in October.
Very much so. Very much so. And thank you for your comments and saying that you there was a value in this and that there's takeaways for you on this. And that's my goal, is to that we share as a community and help our programs become better, and know that we're not out there alone. Sometimes we feel that we are alone, but we're not alone. We have each other, and feel free to reach out to me anytime. This is my life.
Again, thank you very much, and all be well.
Thank you, Katrina.
Thanks so much, everyone.
Thank
All
you,
right, have a
Katrina.
wonderful day.
Thank you, everybody. You have a good rest of your day.
Thank you.